Calling the 1 p.m. Governor's Message Agenda for the Committee on Health and Human Services. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business on March 8th, Friday at 1 p.m. in room 225. For those on Zoom, your audio will be muted and video disabled until shortly before it's your turn to testify. Each testifier will have 1 minute to testify except for the nominees. If there is a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony, that I reviewed them. So I encourage you to use your time either to add additional comments or you can stand on your written testimony. So first up, we have GM 547, Michael Lamb for the Emergency Medical Services Advisory Board. Michael Lamb, are you present? Okay.
Good afternoon. Yes, I am present.
Okay, please proceed. Tell us why you want to be in the Emergency Medical Services Advisory Board. We do have your answers to our questionnaire, but please proceed. Thank you.
Okay. Thank you, Senator San Buena Vista. First of all, I want to thank members of, excuse me, the Senate Committee on Health and Human Services for this opportunity. Being part of the Emergency Medical Services Advisory Committee, or MSAC, to be part of a group that has, the networking, the, having a role, evaluating, creating policies and procedures for state health EMS, I think is something that I'm very interested in. I have just shy of 21 years of service in the fire service and from the Hawaii Fire Department EMS branch. And by being part of the committee, working with them, interacting professionally with my peers, colleagues, mentors, it'll expand my clinical and managerial knowledge of an ever-evolving field in healthcare. Thank you.
Okay, thank you very much. I also have my vice chair here, Senator Aquino. Next, we have Alvin Bronstein of the Department of Health Resource Administration in support. Elizabeth Char, also in support. Anybody else for GM 547? Seeing none, members, any questions? So I do have a question, Mr. Lamb. So is this your first time on the Emergency Medical Services Advisory Board committee?
Yes, this is my first nomination. I have attended the advisory committee meetings, the in-person meetings in the past, not as a voting member, but I went with my supervisor, EMS Chief Chris Honda, also from the Fire Department EMS office.
Yeah, with Kazuo Todd. Okay. So you think you'll be able to, well, it looks like you have the expertise to help out, to help advise in the Emergency Medical Services Advisory Committee. So I have really nothing further. But thank you so much for volunteering. And at the very end, we will decide whether not to accept your advice and consent. Okay, thank you.
Okay. Thank you.
Next up, we have GM 548, Hannah Preston Pita for the Health Planning Council, Hawaii County Sub-Area. Dr. Pita, Preston Pita, please proceed.
Mahalo, Senator. I wish to be a part of this committee because I feel like I have the qualifications necessary to provide the voice of healthcare on our island. Working in rural underserved areas, I notice the gaps in healthcare services, geographical isolation, in rural areas, provider shortage and accessibility issues, and I feel that I have the necessary experience. I sit in several coalitions and task force that basically provide you know, the boots on the ground and the understanding of a more global healthcare system that we can provide for our island. So if given this opportunity, I will be the voice for our island members. Mahalo.
Okay, thank you very much. Next up, we have Dr. Lewin of SHPTA in support. Are you present? No, I don't see him here. Okay, next up, we have Jean Miskovich for the County of Hawaii Office of the Mayor in support. Tammy McGeek, Hawaii County Sub-Area Health Planning Council in support. Sherry Lynn in support. Susan Leloy in support. Alan Johnson in support. Shayna Kokila in support. Anybody else wishing to testify on GM 548? Members, any questions? So, Dr. Preston Peter, are you present?
Yes, I am. Sorry.
Okay. No, it's okay. So I know personally of your involvement of BISAC. In fact, I went to your clinic just last week.
Yes, that's correct.
So I do know you are very much involved. So my question is, do you think I could see your council in being helpful to the Health Planning Council, especially in underserved areas like the Big Island? But do you feel that you will have the time to devote to this?
Of course.
Knowing the many jobs you have, knowing the many hats you already serve,
Yes,
the Big Island Sentinel Task Force, among others.
Yes, I know that it's going to be a commitment, but I feel like it's the best, in our best interest for me to be a part of this committee.
Okay, thank you very much.
Mahalo.
Okay, moving on. Next is GM 549, Colette Kahn for Hawaii Planning Council Honolulu sub-area. Colette, are you present? Colette Kahn? Okay, those testifying in favor of GM. Well, I'm sorry. Oh, it's still here. That's the reason. Okay, so GM 549 has been removed, has been withdrawn nomination. So we'll move on. GM 551 is next for Trisha Kajimura. I see Trisha, Hawaii Planning Council, Honolulu sub-area. Come on up.
Aloha Chair, aloha Vice Chair. Thanks for the opportunity to talk about my nomination today. So for the duration of my career, I've been working with communities that have challenges accessing traditional healthcare, and I'm hoping that I can bring that perspective to reviewing certificates of need for health services that come through the council.
Okay, thank you very much. Next, we have Dr. Lewin testifying for SHPTA in support. Pedro Haro, American Lung Association in Hawaii in support. Pedro, are you present?
They're unavailable on Zoom.
Next, we have Brian Kusumoto, Parents and Children Together in support. Brian Talisayan, Mental Health America of Hawaii in support. Lisa Maruyama, Hawaii Alliance of Nonprofit Organizations in support. Nikos Leverance, are you present?
They're also unavailable on Zoom, Chair.
Okay, also in support. Catherine Davis in support. Don Kurisu in support. Anybody else wishing to testify on GM 551? Members, any questions? So Trisha, I have a couple of questions. So I also know you in your work with the mental health
Task
force, Kokua. So I do know that you could substantially help and be part and give your manao as part of the council. My question is this your first time?
Yes.
Okay. You also feel that you have the time to help with the task force?
Yeah, no, I really think this is important, and that these certificates of need are carefully reviewed according to the state plan and how different communities are going to be able to improve their healthcare access. So yeah, I'm committed to serving.
Okay, especially for mental health, right?
Yes.
Because there are deserts available. Okay, thank you.
Thank you.
Anybody else wishing to questions for Tricia Kajimura? Okay, seeing none, moving on. GM 553. We have Rania Boyer, Health Planning Council, Tri-Isle Sub-Area. Oh, I see Rania Boyer. Please proceed.
Yes, thank you. Aloha. Thank you for the opportunity to speak with you all today. I am grateful for this opportunity to serve potentially and use the background that I have in healthcare and community and to represent the island of Lanai on this commission. Thank you.
Okay, thank you very much. Anybody else wishing to testify on GM 553? Okay, members, any questions? So I do have one, Rania Boyer. Thank you very much for responding to the questionnaire. I didn't really see your, I didn't see your resume. So other than, I said you are the executive director of Lanai Community Health Center.
I previously was. I no longer am the executive director for the Lanai Community Health Center.
Okay, so what do you feel like you can do to contribute to the Health Planning Council?
I continue to work in the healthcare field. I'm working for a healthcare organization in a hybrid situation where I'm working mostly remotely, but sometimes on site. And my whole career has been in healthcare, and I feel like I have the background and the understanding of needs for what might be helpful for this commission.
Okay, so how long have you lived in Lanai or in Hawaii?
My family has been here since 2021, so almost 3 years.
And you've lived in Lanai the entire time in the 3 years?
I moved here with my family in 2022, so I've been here for approximately 2 years now.
Okay, and before that you were in Alaska?
Yes.
For how long were you in the Alaska? It looks like you were part of your Community Health Aid Program Certification Board. What is it that you did in Alaska?
So I worked I worked in various roles. My whole career has been in healthcare. I started off as a community educator in diabetes prevention, and then I worked as the director of our diabetes department. I worked in nicotine control and prevention, and then I worked as the director over the Community Health Aid Program, which is kind of a unique program in Alaska, which is a program that was developed to address the lack of healthcare providers that are in the very rural areas of Alaska.
Yeah, it looks like to me you are the Yukon?
Yukon Spectrum Health Corporation, yes.
Okay, so yeah, it sounds like it's a very rural area.
Yes.
A lot of indigenous people in the Yukon area like they are in Lanai?
Yes, that is correct.
Okay. Okay, well, I have no further questions. Any questions? No? Okay, moving on. GM 554, we have Hawaii Planning Council, Windward Oahu Sub-Area, Sherry Chu. Sherry Chu, are you present? No? Okay, so we have her response to our questionnaire, where she's a member of the Daniel K. Inouye College of Pharmacy practice faculty. We have Shipta, Dr. Lewin testifying in favor. We have Ray Matsumoto, University of Hawaii, also in support. Anybody else wishing to testify on GM 554? Okay, seeing none, no one to ask questions of, so moving on. GM 556, Samuel Ray Rice, for the State Council on Mental Health, for a term to expire June 30, 2027. So Samuel Ray Rice, are you present?
They are available on Zoom, Chair.
Okay, please proceed.
Afternoon, Chair, Vice Chair, Committee of the committee members. Ray Rice, Department of Human Services. I became involved with the State Council on Mental Health in 2021 and attest to its full commitment and working to ensure that medical health support and services are available to individuals in need in all communities. I appreciate the opportunity to continue. Thank you for the opportunity to comment.
Okay, thank you very much. Next, we have Hawaii State Department of Health in support.
Well, good afternoon, Chair Sandra, Vice Chair. I'm Garland Major Hildebrand, I'm in the Adult Mental Health Division, and stand on
In support.
giving support, including for the other nominees.
Okay, thank you. Next, we have Department of Human Services, also in support.
Good afternoon, Chair, Vice Chair, and a member of the committee. I'm Daisy Hartsfield, Social Services Division Administrator. On behalf of our Director, Kathy Bett, the department did submit written testimony in support of this nomination and confirmation, and we stand by that written testimony. Mahalo.
Okay, thank you very much. Okay, anybody else wishing to testify on GM 556? Members, any questions? So I do have some questions. Mr. Rice, it seems like you've had some problems over 30 years ago, but you have since done better. I mean, are you getting this? I mean, it looks like you are super active with the Department of Human Services. What do you feel you can do to contribute to the program?
Well, I think my experience in past positions working with different projects, for example, the discharge projects from the mental health hospital in Washington State, where I gained the experience in working together with community partners, planning, pulling together pools of funding for exceptional rates. I think that's a very good experience, and we haven't been able to discuss those types of pulling together of resources in the council at the moment, but in the future, if it comes to that, I would be in a pretty good position to share some insights.
Okay, and it sounds, when was it that you worked in Washington State on the reentry program? Because I don't see it here.
It would have been about 12 years ago.
Okay, so it's pretty recent then. Okay, thank you very much. And it does sound like it's something that that the State Council on Mental Health will be able to benefit from. So I do appreciate that, and you do have people who believe that you can contribute that way. So thank you for that. Anybody else wishing to testify? I mean, questions of Samuel Ray Rice, GM 556. Okay, moving on. GM 557, Leah Diaz, State Council Mental Health. Hello, aloha, come on up.
Aloha, Chair, Vice Chair, member of the committee. Thank you very much for having me here today to consider my nomination. I'm Leah Diaz. I am the Division of Vocational Rehabilitation Administrator. I've been serving on the State Council on Mental Health since 2022. I have spent my entire career working with people with disabilities, including those with psychiatric mental health concerns, in particular related to preparing them for independent living and employment. So as a member of the council, I hope to keep that voice there for training employment opportunities for individuals with mental health concerns, to ensure that their mental health concerns are taken care of, and also possibly for our consumers that we serve in DVR to be part of the solution as far as a workforce to work in the mental health field. Thank you very much.
Okay, thank you very much. Okay, anybody else? Okay, next we have Department of Health and Support. Are you testifying also in support, resting on your written testimony?
Yes, we are.
Okay. Next, we have Kathy Betts, Department of Human Services and Support. Are you present, Director? Marian Suji and Support. Anybody else wishing to testify in GM 557? Members, any questions? So I do have a question, Leah Diaz. So this is going to be what, your second term?
Yes.
What do you feel that you could do in your second term that you haven't done in your first term?
Oh, well, discussions on the council have been active and changing, and there's been a lot of discussion recently related to trauma, especially post the Maui fires. I hope to be able to contribute to that discussion. And again, to keep employment at the forefront, employment needs and mental health needs. We have also been having a lot of discussions related to the workforce pipeline, as I mentioned earlier, making sure that we have sufficient mental health resources in the community. I hope to be a part of that discussion as well. And as I mentioned, hopefully part of the solution with the consumers that we serve, who can certainly be trained and work in that field as well.
Okay, so you feel like you are positively contributing towards those discussions. So hopefully we could have solutions moving forward.
Yes.
Okay, thank you very much.
Thank you.
Any other questions of Leah Diaz? Okay, seeing none, moving on. GM 558, John Fuji, State Council on Mental Health. John Fuji, come on up.
Chair Buenaventura, Vice Chair Aquino, and committee members, thank you for hearing me today. My name is John Fuji. I work for the Healthcare Services Branch, Department of Human Services under the MedQuest Division. And so I start by my testimony. I think a lot of the work that we do at Medicaid touches many lives in the state of Hawaii. And we have an emphasis as we deliver services to our members on the behavioral health aspects of care, and also how we integrate behavioral health with physical health. And you've heard, many times, I think Judy Moore-Peterson talk about some of the things we're working on and how we're trying to treat the whole person and not just parts of the person, not just the physical body, but adult dental program, but also, the brain, but also the mental health aspects of, so it's a whole person care approach. So we take in Medicaid. This is my second term. So I'm currently serving, and this is the second term I think I'm applying for. Just to answer your question you asked, Leah, so I think we're doing exciting things with our 1115 waiver right now. There's some new things coming on board with medical respite, with our CIS Plus, with our in-reach services into the prison. So, and a lot of those certain new services we're proposing overlap with the same people almost, and those are the folks that have oftentimes mental health or multiple chronic disabilities. And so I think with the State Council of Mental Health, part of what my role has been is sort of a lot of communicating what Medicaid is doing to the council, so they understand sort of the role we're playing and the things we're stepping into. And this past year, obviously, was sort of communicating with the council around the Pink Envelope campaign and how to keep our members covered under MedQuest. So I see that sort of continuing, communicating what we're doing with our programs, especially our newer programs as well, and also serving as a sort of a person that can sort of answer questions too. There's also but yeah, I'll just stop there.
Okay, thank you very much. Okay, so testifying in favor of GM 558, Hawaii State Department of Health and Support. Okay, thank you. Department of Human Services and Support.
Hello, Chair. Kayla Peterson, on behalf of Cassie Best, Director of the Department of Human Services, we stand in strong support of this nomination.
Okay, thank you very much. Next, we have Rachel Wilkinson, Ohana Health Plan and Support. Okay, we have Kaiser Permanente.
Hi,
Support.
Michelle, Kaiser Permanente. We stand in strong support of John Fujii, and we stand by written testimony.
Thank you very much. Next, we have Aloha Care, Mike Nguyen, and Support.
Good afternoon, Chair, Vice Chair, member of the committee. Mike Nguyen with Aloha Care, we stand in strong support of John Fujii as well. And stand on our written testimony.
Okay, thank you. Next, we have Hawaii Association of Health Plans in Support. Anybody else wishing to testify in GM 558? Seeing none, members, any questions? Okay, seeing none, you already answered my question. So very efficient. Okay, next up, or last person, GM 638, State Council Mental Health, Lily Christine Montague Hicks. Lily Christine Montague Hicks, please come on up.
Good afternoon, Senators. Thank you so much for hearing me. I wish to be part of the State Council on Mental Health for two reasons. One is professional. I would represent the Department of Education. In my role with the Department of Education, I serve as the State Mental Health Agency Coordinator for Project High Aware 2, which is advancing wellness and resiliency in education. So really looking at school-based mental health services. And the other reason is personal. I have family history of individuals experiencing mental health illnesses. And so my life work has been around working in the mental health field. And I feel like I can contribute to the State Council, both professionally, but also personally from the insight that I bring from that arena, as well as my professional background.
Okay, thank you very much. Okay, next up we have Hawaii State Department of Health. Stand in support?
Yes.
Okay. Anybody else wishing to testify in GM 558? Okay, come on up. Please identify yourself.
Aloha, Chair San Bonaventura and Vice Chair Aquino and Senate Committee Member Shimabukuro. I am Cynthia Chappell with the Hawaii Department of Education. I'm an administrator in the Office of Student Support Services. And I stand in support of the nomination of Lily Christine Montague Hicks for the State Council on Mental Health.
Okay, thank you very much.
Okay, mahalo for your time.
Okay, anybody else wishing to testify on GM 638? Seeing none, members, any questions? So I have a couple questions. Come on up. So, and maybe I missed this and I apologize. Is this your first term or your second term?
This would be my first term.
Okay. So what do you see as your vision as to how you can contribute to the State Council on Mental Health?
First of all, I would be able to, one, represent the Department of Education, and part of that role is making sure that all of our children and youth have access to mental health services. But not only that, making sure that they can coordinate with all of the other state organizations that our children intersect with, as well as looking at policies that will affect our children's mental health services. And so I feel like I can bring that professional experience to the table, as well as I have served on previous advocacy boards in my professional works in other states.
Okay, thank you very much. Okay, members, any questions? Do we need to recess for decision making? Are we good?
No need.
Okay, thank you. We have quorum, so we need vote sheets. Okay, we are going to take it all on one vote. Chair's recommendation is to advise and consent to all the nominees today, and that would be for GM 547, GM 548, GM 551, GM 553, GM 554, GM 556, GM 557, and GM 558. Any comments, questions, concerns? Seeing none, Vice Chair, excuse me?
You forgot 638.
Wait, so sorry. And of course, sorry, GM 638. Any comments, questions, concerns? Okay, seeing none, Vice Chair for the vote. Chair's recommendation is to advise and consent.
Okay, Chair's recommendations is to advise and consent said GMs. Okay, Chair votes aye, Vice Chair votes aye. Senator Kehokolole is excused. Senator Shimabukuro.
Aye.
Senator Awa is excused. Recommendations are adopted, Chair.
Okay, congratulations and thank you for your service, continued service, and hopefully you can contribute to the state's policies as we move forward. So thank you, folks. We are adjourned.